Welcome to the Parenting Tips Podcast. I'm Jeff Reiland, the host of this podcast series. In this episode, we are going to be talking about parenting with addictions. This is not a small topic because there is so much cultural stigma associated with addictions. We're going to spend a little time talking about terms and hopefully dispelling or at least gently challenging some of the myths that surround addictions. If you are just tuning into this episode on parenting with alcohol and other addictive substance disorders, I highly recommend that you include episode 59, Parenting with Mental Illness or Addictions, to your listening and learning experience. Even though there are big differences between the illnesses described in this series, there is so much overlap in terms of what a parent can say and do to help your child or children to be the best possible parent. In addition, episode 59 contains some of the best resources for parents and for children who are struggling with parents' mental illness or addiction, and those links are in the show notes. What addictive substances are we talking about here? Well, according to Johns Hopkins Medical Center, substance use disorders is a medical term used to describe the pattern of using a substance, a drug, that causes significant problems or distress. This may be missing work or school, using the substance in dangerous situations like driving a car. It may lead to substance-related legal problems or continued substance use that interferes with friendships, family relationships, or both. Substance use disorder is recognized as a medical brain disorder. It refers to the use of illegal substances like marijuana, heroin, cocaine, methamphetamine, or the misuse of legal substances like alcohol, nicotine, or prescription medications. Alcohol is the most common legal drug associated with substance use disorder. I have worked with families struggling with addictions since the mid-1980s. In 1992 and 93, I co-taught a course on addictive behaviors at the University of Wisconsin-La Crosse. Then, when I became a dad, it got really busy at home. So I took a break from teaching this course until 2011. In 2011, I began to teach the course again with a complete course redesigned. After 13 years of teaching about addictive behaviors, I can say that we as a society have learned a great deal, and there is so much more to learn. So much has changed from when I since started working with families suffering from addictions back in the 1980s. We have come a long way in our understanding about addiction and many of the myths that have perpetuated in our society. It is easy to look down on someone who drinks too much or buys and uses illegal drugs. We are talking about drugs and alcohol. We try to separate them out. In a few ways they are different, but in most ways they are the same. In the upper Midwest, especially Wisconsin, alcohol is a common social lubricant. For some people, they could not imagine socializing without it. But why? It is a frightening truth that more people die each year from tobacco and alcohol-related causes than all of the other prescription and illegal drugs combined many times over. Yet alcohol and tobacco are legal for adults over the age of 21. The roots of the current cultural attitude about substance use, including alcohol, goes back several hundred years and would be a worthwhile topic to learn more about. But our focus is on when a parent struggles with addiction, a substance use disorder, including alcohol, or is in the process of recovering from this addictive substance. To be sure, these behaviors can cause many problems from a social, health, legal, and societal standpoint. Why do people use substances, including alcohol and nicotine products? There are many reasons people use any substance: to change their mood, to relax, to fit in, to loosen up and unwind, to sleep, to manage anxiety, to escape depression or memories of trauma, to numb pain. It begs the question, aren't there better, safer ways to relax, fit in, loosen up, unwind, sleep, manage anxiety, depression, or physical and emotional pain? The answer is yes, but these take time and effort. It takes courage to look at this problem in our lives or in the lives of our loved ones. It takes courage to talk about it. It takes courage to try to change. It has been an honor to work with many families with addiction over the past 38 years. It is especially rewarding to see a parent begin the journey of recovery and successfully parent throughout this process. These parents and their children are an inspiration to me. There's a tremendous amount of guilt and shame surrounding addictions to alcohol and other drugs. We sometimes not only avoid the topic, we avoid the person struggling with these disorders. Yet we're learning that like depression, anxiety, bipolar disorder, and many other medical conditions like diabetes and heart disease, addictions have a strong genetic or hereditary component that, combined with stressful childhood experiences called adverse childhood experiences, can push an individual into this negative addictive spiral. We will talk about adverse childhood experiences in a coming episode. The very thing that people struggling with addictions need is connection with others, not isolation or being shunned. It can be especially hard to trust someone with an addictive behavior, especially in a family when family members have been hurt or burned by the alcoholic or addict's behaviors. I'm not suggesting they get a free pass. However, it's also important to try to understand that through the framework of the disease model of addictions, the addict suffers and can experience periods of recovery and relapse, just like any other major medical condition, including asthma, cancer, and diabetes. Yet, as a society, we view addictions very differently. We have work to do. In this episode, if you are a parent struggling with addictions or working a program for recovery, I hope you find this information, the tips, and other resources that will help you on your journey, both as a parent and as someone dealing with addictions. This episode is an introduction. I hope you will explore the links to additional resources for you and for your children in the show notes. Parenting is the hardest job you will never train for. Having layers of mental illness, addiction, or trauma on top of this does not make it easier. Let's add a few tools to your parenting toolbox. So, why are our loved ones unable to stop using or drinking? Why can't they just quit? Dr. Gabor Mate, a family physician, is the author of the book In the Realm of Hungry Ghosts. It was published in 2010 and became a Canadian bestseller. And it is understood and known as a classic, groundbreaking book that has proven to be prophetic in terms of the way science and society are starting to view addictions. In his book, Mate persuasively argues that the organ that is impaired by addictions is the brain. When someone has a foot injury, their brain tells them to go see the doctor. If someone is having chest pain, their brain tells them to go to the ER. But when our brain, the organ that is responsible for making decisions, has to get help and it's impaired, that message gets lost. Why dedicate an episode to this topic on parenting with addiction? Because addictions are really common. According to the Substance Abuse and Mental Health Services Administration, based on data gathered over the past few decades, 1 in 8 children, about 8.7 million children, 17 years and younger, live in a household with at least one parent who has a substance use disorder to either drugs or alcohol that has caused significant impairment. 1 in 10 children, 7.5 million children, live in a household with at least one parent who has an alcohol use disorder. And 1 in 35 children, 2.1 million, live in a household with at least one parent who has an illicit or illegal drug use disorder. The impact on children is not small. According to the Addiction Policy Forum, children who have a parent with a substance use disorder, including alcohol, are more likely to see and hear more fighting and arguing between parents and other adults, more likely to witness illegal activities, more likely to live in poverty or some form of unstable housing or food shortage, more likely to lose more stable relationships with caring adults and experience relationship instability. The resulting chaos and trauma can affect their physical, social, and emotional well-being for their lifetime. Parental addictions can risk harming physical health, academic performance, relationship formation for children. It also puts children at an increased risk for developing mental health and substance use disorders as they grow up. There are a number of signs that might indicate that your substance use is affecting your child. These include your child taking care of siblings, or sometimes taking care of you or the other parent at a very young age, taking care of themselves at a young age, missing school, acting out in school, dropping grades, never wanting to be home, taking on adult responsibilities at a young age. Children may show signs of high functioning, but underneath they are anxious and distressed. So what can parents do? Well, here is a great opportunity to begin to break the cycle of addiction by starting this conversation with your children. For many parents, it can be one of the hardest conversations ever. You are opening up and becoming vulnerable. You are also taking an important step toward health. Talk with your child. The age of your child will help guide you in knowing how much to say and in how to say it. Many young children have experiences like the flu. It's often referred to as a bug. While not scientifically accurate to call drugs and alcohol yucky bugs, it may be useful as a device to help young children understand that when you use drugs or drink alcohol, it makes your body and mind sick. We as adults know that it is far more complicated than this. If the drug or alcohol were truly yucky bugs, then anyone using them would get sick. Yet only a fairly small percentage of people, between 10 and 20% who drink or use drugs, develop a problem with them. This clearly suggests that there is more going on in the brain of a person suffering from an addiction. There's a pretty good chance that your child has some ideas that things are not always okay with you, especially if you've been drinking or using. Kids pick up on stuff. They may not have words to describe it, but they may worry. And they may see a pattern of your behaviors, and they'll feel responsible for it. Listening to your children, talking with them openly about addictions, whether to alcohol, nicotine products, or other substances, is important. For children 6 to 8 years of age, you can say that drugs and alcohol can make people feel okay for a while, but then they make them act and think differently. Some people who use drugs or drink have problems with the drugs or alcohol, and they can get very sick. You can tell your child that since they did not cause this, they don't have to feel guilty. It's not their fault. For children between the ages 9 and 12 years of age, you can say drugs and alcohol mess up the rules of our brains, like changing the controls in a game. They make our brains think it wants more, even if it's not good for us. They fool our brains into thinking everything is okay, when everything is not okay, and life is actually going pretty poorly. For teenagers who may be at risk for starting to develop their own curiosity and experimental use with substances, it may be helpful to share some of your own story and mistakes, as well as the genetic risks that they may carry and the huge risk factor that early use poses when young teen brains are still developing. Early substance misuse, before the brain is done developing, usually in a child's mid-20s, creates a serious risk for future substance abuse problems. Another tool is to share the 7 C's with your child. The 7 C's was developed by Jerry Moe and the National Association for Children of Addiction. The National Association of Children of Addiction is a nationwide organization working to stop the bad effects of alcohol and drugs on children and families. The 7 C's is a good way to remember how to talk to children. It's a quick, effective strategy to address what children often worry about deep down when their parents are having drug or alcohol problems. The 7 C's mantra is, I didn't cause it, I can't control it, I can't cure it, but I can help take care of myself by communicating my feelings, making healthy choices, and celebrating me. The link to this wonderful PDF resource for children titled Tools for Kids is available in the show notes of this episode. This PDF reviews the 7 C's and has many other thoughtful activities and answers for parents and children. What if it's the other parent who has the addiction? So much depends on your relationship with the other parent or loved one. It may be helpful to share this information or this resource with them. The most important thing to do, however, is to take care of yourself and take care of your children. We've been talking about addictions and how to tell your child limited information about your addiction. This is a part of parenting. but it's not the whole story. As if you did not already know, parenting is hard work and stressful. It is not made easier simply by not using substances. Consider the dilemma. If drinking or using substances was a way of coping with stress, and you make a decision not to use this, what's going to replace it? Being sober or clean, or being on a journey to using less to reduce risk of harm, does not instantly make parenting stress go away. I really wish that it did. In fact, I wish all parents in early recovery would immediately have well-behaved children. This is not going to happen. Kids pick up on the slightest of changes in parents. If one person changes in the family, it can and will affect everyone else. If in the long run, not using is a good thing for your health and for your relationship with your children, in the short run, there can be some miserable days. Think about it. If during your using days or drinking days, your kids had a bit more freedom because you were preoccupied with your use, and now you're back in charge at home, enforcing rules, having expectations of getting things done, it may be a change for them. On the one hand, they may like the new you. On the other hand, it may take some getting used to. It's not uncommon for kids to be a little surprised that they have to make some changes too. They may resist this. For example, if they used to have less limits on how much social recreational screen time they used to have, and now you're expecting homework, chores, and other activities to come first, be prepared for some pushback. Parenting and recovery is stressful. Taking care of yourself is important. You can do this in many ways. One is seeing a therapist, going to a support group or support meetings, exercising, getting enough sleep, eating well, and surrounding yourself with friends and family who support you making changes in your life that will keep you healthy and will help you to be a more effective parent. The second thing you can do is introduce structure and routine into your children's lives. Maybe it was already there. Maybe it has always been there. Maybe it got a little fuzzy during the time you were using. No matter. Kids need to respond to some sense of predictability and routine. As a parent, you can help accomplish this by having specific routines around morning time, bedtime, weekend time. When kids have a sense of what they'll be doing each day, they tend to behave better. I'm a big fan of routines, but not rigid routines. It's okay to have a sleep-in for a few hours on a weekend day. It's okay to switch things up when it comes to activities. This can enhance flexible thinking. But in general, it's best if kids have a sense of what the day is going to look like. Invest quality time with your children. Relationships between parents and children are built on many experiences. It is not uncommon for a parent, when caught up in the throes of addiction, to lose quality time with children. It can't be made up overnight. However, making sure that you take time and reinvest in playing with your child, creating new memories, enjoying your time with them, reading to them, sharing adventures with them, those things can go a long way in healing your relationship with them and setting a new path for your future together. It may be helpful to go back to episode 2, the parent-child relationship, to get a reset on what your goals are with your child or your children. There are many episodes sprinkled throughout the Parenting Tips podcast that can help you to build or rebuild your relationship with your child. Provide nurturing. All children need some amount of nurturing. Each child is different. Some kids like to snuggle. Other kids are okay with fist bumps. It's important to accept your child where they are at and not force it. It may take some time for that comfort to be reestablished. One of the elements of recovery that is important in parent and child relationships is trust. When trust is broken, it takes time to repair. Children can be remarkably forgiving, more so than most adults, so be patient. Finally, stay calm. Even in normal circumstances, kids misbehave. They argue, they push limits, they get on your nerves. If you've been following this podcast for a while, you've hopefully picked up on many tools. The ability to remain calm is one of the most powerful secret ingredients to effective parenting. If parents are shouting or ranting or otherwise losing it, it's very hard for the child to calm down. Work on staying calm, taking a break, yes, your own time out, to collect your thoughts and approach the situation more calmly. You can model being calm. Your children will learn faster. Please remember, there's a big difference between a slip and a relapse. A very normal and common part of the recovery process from addictions to substances is relapse. This is a return to previous patterns of use. For many, it can feel like failure. I see it as an opportunity to grow and learn. There is a huge difference between a small slip that might have occurred for a day or two and a full-blown relapse. Slips can be really useful in helping the person in recovery determine where their vulnerabilities are and take steps and make changes to correct them. They're usually short-lived. Relapses can go on for weeks, months, even years. They're particularly destructive to relationships as trust is broken again. If you have a slip, tell your child about it. The more open you are about setbacks with others in your life, including your kids, the more likely you are to get back on track to recovery. For example, if you're keeping track of the number of days you've been clean or sober and you have a slip and your child still thinks it's been 5 months when it's only been 2 days, you're allowing them to perpetuate something that's not accurate. They're living in a lie because you're not telling them the truth. Again, while you might experience some shame or embarrassment from a slip, you can look at it as an opportunity to grow and learn. You're not starting over. You're building on what you've already learned to make your recovery stronger. If you're in recovery, you have a disease, just like any other chronic disease. There are recurrences of the disease. Yet, do we judge cancer patients who have a recurrence? Why do we judge alcoholics or addicts? Be prepared for your child or children to not always like the new you. If you were previously not available to be the parent, to have rules and expectations around schoolwork, chores, screen time, bedtime, and now you do, your kids may not be thrilled. In moments when tempers run hot, they may say some hurtful things such as liking it better when you were using or drinking. Please stay calm and don't take shots like that to heart. Kids get mad. They use the hate word. They don't mean it. They're just angry. Stay calm and remind yourself of your goals as a parent. A parent in recovery is many times more present and effective than a parent who is actively using. At some point in time, you may have some work to do in making amends to your child or children for how your drinking or other substance use affected them, how it hurt them. Please don't rush this. Give it some long thought as part of your own recovery. However, don't stall and put it off either. As painful as it can feel, it can also be incredibly healing when you, the parent, seek forgiveness from your child for harms you may have caused when you were using. This is an important part of the repair and healing process. You may sometimes be blindsided by accusations from your child that you were using or drinking when you weren't. Stay calm. Listen to their concerns. Consider their own experience and their point of view. For example, if in your using days you said you would be home at a certain time and you more often arrived home several hours late, drunk, they may be triggered to having that same fear if you arrive home several hours later than you said you would, but this time it's because of a work conflict. Some of their thoughts and fears may be raw from your using days. Remember, it takes time to heal. I mentioned earlier in this podcast episode that the opposite of addiction is connection. This isn't my quote. It comes from the work of journalist Johann Hari, author of Chasing the Scream, The First and Last Days of the War on Drugs. Mr. Hari has a wonderful TED Talk on YouTube titled, Everything You Thought You Knew About Addictions is Wrong. If you are struggling with a loved one's addiction, this may be a good place to start to learn more about the importance of the social connections we all need to survive. In addition to this TED Talk, there's an excellent document from the Addiction Policy Forum for parents and all community members who care about children affected by a parent with a substance use disorder. Many adults, teachers, coaches, pastors, and family members are uncertain of what to do. This resource helps parents and other community members come together. Remember, it takes a village to raise a child. Also, there is a great resource from the National Association for Children of Addiction for parents or other caregivers to go over and share with children called Tools for Kids. Both of these resources can be found in the episode show notes. To summarize, parenting is hard work. It is made harder when you are either struggling from an addiction or recovering from an addiction. 1 in 8 children live in a household with at least one parent with an addiction to alcohol or other substances. Parents can feel more successful as parents when they get help for themselves. Talk with your children about your struggle. Kids respond to positive structure and routines in their days. Strive to provide stability in this way at home. Invest quality time with your children. Put your devices down. Give children your undivided attention. Be prepared for some pushback to changes that you want to make in your family. Change can be hard for everyone. And finally, keep your eye on the goal. Being the best parent for your child or children. It takes work. It is achievable. No one is perfect at parenting. Learn from your setbacks. I hope this information and the tools from this episode move you in a positive direction of change that helps both you and your child or children. Remember the words of Maya Angelou, do the best you can until you know better. Then, when you know better, do better. Thank you for tuning in and considering this parenting topic. I hope this information added to your growing toolbox of parenting your child or children. Please consider exploring other topics in this series. Remember, no one parenting tool can do everything. We need many tools to become the best parents for our children. Your children's future depends on you and the time and effort you invest in them today.